Hope you're all fine. We are going to wait one more minute for everyone to join. Yeah, we have some viewers who says, hello, Clinic Up the Best. Thank you so much. We can wait one more minute to everyone join. Okay, I think we can start. I can introduce myself. I am dietitian Eda from Clinic Up Bariatric team, and we are here 3 dietitians actually. Dietitian Duygu, and we have dietitian Berna is our manager. Today we are going to talk about what to expect during our journey. And can you introduce yourself?
Sure. Hello, everyone. I'm Alvita Yakar, Hospital Operations Supervisor at CliniHub. I hope we will have a great live session tonight, and we are waiting your questions.
Yeah. In last 10 minutes, we are going to answer your questions, so you can drop your questions in the question box. Yeah. I can start with little by little and talk about the pre-operation a little bit. When you book your surgery, good evening to everyone, yeah. When you book your surgery as a bariatric nutrition team, we are going to send you your pre-op diets like 2 weeks, 3 weeks before your surgery, and you are going to do a liquid diet in this process. We are going to send you all the informations about this. When you book your surgery, we are going to reach you, and you are not going to be alone in this journey actually. So Alvita, can you talk a little bit about the pre-operation journey? How was it for the patients?
Of course. Actually, as a field operations team, we are contacting our patients a couple days before their arrival to Turkey. We are shortly giving some information about the hospital process. And when patients are arrived to Turkey, they are picked up from the airport, and the drivers are bringing them to the hospital. At the hospital, our lovely field coordinators are welcoming the patients, and hospitalization at the hospital begins. First day at the hospital, it's mostly preparation for the surgery. Some pre-op tests are done for the patients. First of all, when the patients are settled down at their room at the hospital, nurses hospital nurses are coming and asking some questions about medical background, about the patient, and taking some blood samples. Secondly, like we are going some tests as well, chest x-rays done, also abdominal ultrasound are done to check internal organs. Also, actually, it's really advantageable because also you can find out if you have some gallstones. So during your gastric sleeve surgery, you can combine that surgery as well. When all these tests are done, anesthesiology doctor are checking the patients and all the test results, if you are suitable for the surgery and if everything is okay. And finally, you are meeting your operating surgeon. Before the surgery, you are having consultation with the surgeon, all your questions are answered, and also our field coordinators are all the time assisting you.
We are all happy to assist you in this journey, so you are not going to be alone in this journey, right? In hospital, in pre-op, in post-op, we all surround you by our love and with our information, so you are not going to be alone in this journey. I can talk a little bit about the post-op diet, what we are going to do with you. So after 1 day or 2 days of your surgery, we come to see you in your hospital room and talk everything about your nutrition. Because of you are going to do like step-by-step nutrition program. We are going to explain all the details to you in your hospital room. We are going to chat a little bit. We are going to have a walk a little bit and talk all of your nutrition. So, and we also provide you some proteins and multivitamins and some water drops to you too, to ease the process for you. Because of you are going to do like step-by-step nutrition program, you are not going to be alone, and we are going to help you in this process to you. And after we come to your hospital room and after we talk about your nutrition, we are going to give you our products, and you are going to start your diet a little bit. Because of you are going to do a liquid diet after your surgery. It depends on the person, but like 7 days, 10 days maybe. We are going to tell everything about the liquid process to you. And after that, we are going to have a little walk with you to ease the like gas or like your discomforts. So we are going to help you in this process too. Yeah. And what is going to be after 1 day or 2 days after surgery?
Actually, it's not easy journey, let's say, at the hospital after the surgery. But our field coordinators and our lovely dietitians are there to help you and as Eda said, to ease your process. Actually, after surgery, patients are not able, let's say, and to wake up like for 5-6 hours after surgery because you might feel dizzy and nauseous. But it's really kind of, let's say, normal after these kind of surgeries, right?
Yeah.
So after 6 hours, you start to little bit wake up after surgery, starting like short walks. Actually, I think it's the most important like post-op medication, let's say, I think walking. So let's say like push yourself and like take a short walks at the hospital, like you might meet some other patients as well. Actually, our field coordinators are at the hospital as well. We have 3 coordinators. One of them is staying till 12 a.m. let's say,
Yeah.
12 p.m. or a.m. until the midnight, let's say. We are trying to ease your process to be close to you all the time.
Yeah. Exactly. And as a bariatric nutrition team in Clinic Hub, we are going to follow you for 2 whole years. So you are not going to be alone in this journey. We are going to write you weekly after your surgery to check you, to check your toleration levels, to check your weight, to check your, like if you are drinking enough water or if you are getting enough protein or not. So you are not going to be alone in this after surgery too. You are surrounded by our lovely coordinators who talks very good English and with us actually. So yeah. And if you want to stay in the hospital and stay in the hotel, you can do that too. We offer you a hotel package to you too. And in hotel, we have all team from Clinic Hub there too. We have like post-op doctors and nurses, and our coordinators are there to help you too. So if you stay in the hotel, you are not going to be alone, surely, in this process too. So can you give some details about the hotel process too?
Of course. When you stay at the hospital, it might be a little bit boring, let's say, and you are coming to this beautiful country and beautiful city, Istanbul. So I think it's really good opportunity for you to like extend your stay a little bit. And when you are discharged from the hospital, to go to the hotel, maybe for a couple days. As Ms. Eda said, we have post-op team, post-op nurses who are at the hotel 7/24.
Yeah.
All post-op care is given for you. Post-op doctors are visiting you as well. And later when you feel better, you can enjoy Istanbul and good weather here, let's say. Actually, I think it's great opportunity because not just post-op team we have as a Clinic Hub we have at the hotel. Also, we have all patient relations team who are all the time assisting the patients during their journey at the hotel.
Yeah. Exactly. And if you stay in the hotel, you can find different opportunities in the hotel menu available for your diet nutrition program too. So it is not going to be a problem for you to stay in the hotel too. You can order like juices, soups, decaffeine coffees from there too. So they are all going to be assist you there too. And like Avita said, it is a very good opportunity to have a like 3 days, 4 days extra stay and like discover a little bit Turkey and discover a little bit like some good spaces. Yeah. Okay. I think we can look at our questions a little bit now.
Actually, I can mention if you stay at the hospital, if you have the just hospital stay package, don't worry about this. Also at the hospital, before you are discharged, we are providing you all medications, which one you need to use when you come back home. If you prefer this, I think that's a good choice as well. Just trust the process and Clinic Hub because our priority all the time, patient safety and great experience.
Yeah, exactly. Okay. I think we have one question says, how long is advised to stay in Turkey if we are coming from North America? Thank you. We are staying in the hotel for 4 nights, right?
At the hospital?
At the hospital, yeah.
Right.
At the hospital for 4 days.
At the hospital, 4 nights. You are staying 4 nights?
Yeah.
But it's enough as well to stay 4 nights if you are coming from America as well. But it's really long way to come back after the surgery. So it's really a great choice if you extend your stay like for more couple days.
Yeah, actually for gastric sleeve, it is just a 25-30 minute surgery. But like Alvita said, you are going to wake up after the surgery and you are going to be a little bit like fizzy and all that. But generally after 2 days of surgery, you are not going to feel anything, and after 1 week actually our patient says that they are feeling like all normal and get back to their normal lives, right?
Right.
Yeah.
Let's check more questions if we have.
How many surgeries do surgeons perform per day? I think it depends of the day, but we can have like 5, 6 surgeries per day. So if you want to come with your friends or with family members, maybe we can perform your surgery in a day together too, and you can like experience this journey all together too, right?
Right.
Yes. After how long the surfers you need to walk? Actually, after how long the surgery you need to walk? Oh, actually, like Alvita said, when you go to surgery and wake up, there is a gas in your stomach, and it is very, very normal. We are hearing this from all our patients. They said, like, I have gas, I have a little bit discomfort, and we say to them, like, it is very, very normal. But like Alvita said, like, the walking is the best cure, I think. Yeah, we are seeing our patients like walking and getting so much better. So after the surgery, we are suggesting to have like 50 minutes, 60-minute walks after 1 week maybe. But in the first place, like in 2 days, 3 days, you can just have mini walks in the hallway, like 5-minute, 10-minute walks, and then come to your room, rest a little bit, and then go to 5-minute, 10-minute walks again. And you can meet some new people there who experience this journey too in the hallways. So I think it is very good, right?
Right. Actually, in the beginning, walking it might be hard and painful maybe, but let's say we need to push a little bit to walk, but not exhaust yourself because you are after surgery. So just listen your body and like push a little bit yourself. And as I said, walking is the best medication actually.
Yeah. We have one more question. What is minimum and maximum BMI to have sleeve surgery? What options available rather than sleeve surgery? Actually, before the surgery, you are going to fill a medical form about your all health history, and our surgeons decide if you are available or not available to this surgery. So our surgeons decide that. And we have gastric balloon, gastric sleeve, and bypass options in ClinicUp, right? Right, yeah. Okay. And, if we have to stay in the hospital a few more days, can we do it? How can we do it if we want to like stay longer in the hospital?
Of course, you can stay a couple more days, but as I said before, maybe you can prefer staying at the hotel and enjoy it. If you want, you can extend your hospital stay, but actually mostly operating surgeons, they don't recommend you to stay too much at the hospital if it's not needed actually. But of course there is this kind of opportunity.
Yeah. Okay. We have, I think, one more question. For how many days before we have to come for this surgery?
As I mentioned before, 1 day before the surgery is enough because 1 day before the surgery we are doing all pre-op tests and like preparations before the surgery, so 1 day is enough.
So you are going to come hospital 1 day before the surgery, and the day you are going to have the surgery, and you are going to stay 3 more nights. And if you want to expand your longer your journey, you can have options for the hotel too.
Yes.
Yeah. Oh, we have one more question. Can you give us information about the transfer for the hotel? Did they pick us? Did they leave there? Or how is the transfer process from the airplane to hospital to hotel? How is it?
Of course, when you come to Turkey, we already have all your details about your tickets, about your times when you are arriving. So we are arranging everything accordingly. So as I said, you will be picked up from the airport and directly coming to the hospital or hotel. It's accordingly to your package. But from the hospital, if you need to go to the hotel, also all transfers will be arranged by our field coordinators. So just come and enjoy.
Okay, we have one more question. Do we have to come with +1, or can we, if he or she come with us, she or he can stay in the hospital, or can we experience this journey alone?
Actually, you can experience this journey alone. It little bit depends on the person. It's a little bit personally. I would like to be alone actually if I have some surgery. But some persons they prefer to have companion with them at the hospital. Companions at the hospital, they can stay with the patients. They are providing by hospital food, meals and everything. There is a couch for them to sleep. So of course, if you are willing to bring companion with you, you can.
Yeah. And in hospital too, we are going to send you some soups, traditional compote juice, and if you have a companion, their food is going to be provided by the hospital too. So it is not going to be a problem for the nutritional process for you and for your companion too. Okay. Oh, we have one more question. At night in the hospital, do you have someone have someone from Clinic Hub to support us, like coordinators, nurses? Do they stay here?
Yes. As I mentioned before, we have a coordinator who stays at the hospital till midnight and regularly checking after the patients at the hospital and helping them with the translation. Actually, we are field coordinators. We are kind of bridge between the nurses and surgeon and all other hospital staff. So yeah, till midnight we have some coordinator who is staying at the hospital.
Okay. You have a dentist in package. Why? It is actually optional to have a dental appointment, right? You don't have to do it. It's an option for you.
Yes, for our Clinic Hub patients, we are providing some dental consultations as well. So maybe for the future you can have you can plan your dental treatment as well with Clinic Hub.
Okay. We can take your questions. Yeah, someone says I was with my husband in my room for 4 days. Like you said, like no problem with that. Okay, I think we have no questions right now, but if you have, you can ask us, you can like comment below your questions or ask us from the Instagram, all the social medias. We are very happy to answer them. Yeah, I think we have no questions.
Right.
So we can say goodbye, but I want to remind you, if you decide to do this surgery, you are not going to be alone in this journey. We are all here to support you as nutrition bariatric dietitians and our lovely coordinators, right?
Right. You are always welcome to come to Clinic Hub and have this great experience here.
Yeah. We are very forward to meeting you. Bye-bye.
Bye.